mini lift on her about what, 8 months ago?
I think January, beginning of January.
January, she looks real good. What is she, about 38, 39 years old, something like that? Right? Anyway, so today we're going to do the X-Lift. And well, the X-Lift means I'm going to take expression and I'm going to fill up here. A lot of us do that with other products right now. I think it's a great procedure, particularly for people who are in the Never Never Land between, do they need a little bit of this? Are they concerned about their nasolabials and melolabial folds? Because if we put product here, we can actually get a little lift effect. That's why I call it the X-Lift. Okay? All right, so differences between this product and the other two that he mentioned. I like the way expression flows. Okay, I have no involvement with the company, just so you know, other than they give me product. You get 1.5 cc's for, I think, 195 bucks. Juvederm is what, 0.8 for about the same, right? Big difference. So you're actually getting much more product. Of course, obviously, the product has to be competitive in terms of how long it's going to last, how it flows, how it feels when it goes in. And I find that expression flows well. And I find that it doesn't hurt, and I get less reaction to the product. Now, most people aren't going to have a reaction to any of them, but if you do 50 people, somebody's going to call you and say, I've got these red splotches, or I have this bumpiness, and then I give them the talk that maybe that's a little ooze in there, reactions are rare. I've never put anybody on steroids or anything for a reaction with an HA, but I understand there are people that have. You ever had a reaction? Okay. All right, so.
Does it have xylocaine in it, or is it just straight?
It's no xylocaine. But what I like about it is, rarely does anybody have a problem. In fact, I didn't bring them anything. Now, there's some people that they're going to need, you know, general anesthetic if you cut a toenail, if you clip their nails. You know, like my nurse in my office, Nina. Okay? I just shot a little video recently with the reaction. You know, the reaction is no, I have to refirm radio frequency, and I shut the laser off just to show her how it felt. Just it had been turned on, and just the tip was heated. It wasn't going, and she jumps off the table. So somebody like that, they're going to feel it. I use cream on them. Most people, I find they don't even have control. So I think that's one difference, at least in my hands. I think it's easier to eject. I think it flows easier in my hands than the other two products. And it's interesting that it's too long here. It's interesting that it's from a source. They're all bioengineered. They're bioengineered now for bacteria. Everybody knows that, right? And Juvederm is bioengineered from a streptococcus bacteria, which does produce allegedly some exotoxins that could get in the product and cause some reactions. That's what the company says. This company. This product is made by Bacillus subtilis, which doesn't create any kind of exotoxins, and they claim they have no proteinaceous contamination in the product from the bacteria source that makes the product. Another difference. I'm not sure clinically how much difference that makes to us. Okay.
We're going to say any more about later about adverse reactions or risks, or that are you?
Yeah, I'm kind of saying right now I haven't seen. I saw one patient that called me 3 days later and said that she had some little bumps around her face. It wasn't a collection of product. It was probably little areas of oozing under the skin that we can kind of see. It gets sore, probably little tiny collections of blood. No bruising. Or it might have been a mild red.
Say one thing because I think it's very
Sure.
important. What is the worst possible thing that could happen in the injection of a hyaluronic acid filler? There you go. That is absolutely.
What did this say?
When you inject something into an artery, and you're going to get what? You're going to get vascular necrosis. You're going to get dead skin, and the patient's going to be rather unhappy. He's going to freak out. Has anybody ever had anything happen like that? No. Well, it happens even with the best of hands, with any kind of injectable, including a hyaluronic. So, obviously, I'm not going to talk about injection techniques, but I just want to make sure that you understand that. Have some nitroglycerin paste in your office, just in case, because and there's other modalities, but that's likely to happen to somebody in this room at some time in the future.
One of the first signs of that, in my opinion, you see, and I find that's more likely, at least in my experience in using these HACs that came out, is if you see a sudden blanching when you inject superficially, right? That's probably a little ischemic effect, that you've got into a subdermal vessel and you're causing a little bit of local ischemia. What I do is massage that area for a few minutes, a couple of minutes, and then it becomes a little hyperemic, and that tells me that you're getting some flow into the area. Okay. The other one that you didn't touch on was you get intra-arterial, and you're anywhere in the face, but particularly in this area, you get intra-arterial and you're pushing hard. You can cause retrograde flow. You know that up from the face up into the ophthalmic artery behind the eye. When the pressure drops, whatever you injected comes back down and takes the wrong route into the retinal artery. And you know about that. So that is a problem, but it's been a problem with Botox. It's been a problem with anything injected in the face. And Peter has some really neat needles, and he's going to be coming up in about 25 minutes. He has the little needles that are not sharp and has a port on the side. It's a 27 gauge, 1 inch, where it's less likely that can happen, but it's something we think about whenever, particularly around the eyes. Okay, it's pretty rare. I remember when there were only like 6 cases of it 10 or 15 years ago in lectures, and it was from fat transfer at that time, but now it's happening more often now because so many people are using HAs. They don't push hard. That's one of the ways to minimize. Okay, so she's got some nasolabials I'm just going to show us. It's very similar to other products, the way you inject. But you see, are you pretty comfortable when I inject? That's a difference from some of the other ones. Or the other two, my opinion. Not saying they're bad. And from an economic standpoint, compared to Juvederm, you know, and the proof is in the pudding in terms of when I get out to a year, year and a half, 2 years, will this last as long? Will this last as long? Okay. You're getting almost twice as much of product for your patient, almost twice as much product for your patient for the same cost to you.
Where do you inject? How do you make for the nasal labial? Exactly. You start in the fold and then go on?
No, I just did some.
Yeah.
I start out here and I come under. It just depends on what I'm trying to treat. Some guys who really need a face tuck, or they need some kind of pull up here to try to avoid surgery, and you know they can't. I might come in this direction. I go lower because sometimes in these people the stuff climbs up above the fold. So in guys that have big folds, I might go a little lower and try to come this way. And people that have smaller folds, I'll come in underneath like this. Everyone has their own kind of techniques. I think you do what works. Okay, now I'm going to have you do the thing which showed the labials in your face. Okay, when she does this, you know, guys don't think of doing this in the morning. Looking at your face, most guys don't. To bring out all the other terrible things that need to be fixed or they can't be happy. Okay, so she's pointing out here, she's got some of these labial stuff. And again, there's so many different ways to do it, and on her, I'm going to show you what I do. Okay, relax your face a little bit. Okay, the other thing I do, and I'm sure Peter will comment on this, I go up like this, I push some product up, and I can actually curl the side of the mouth up a little bit on a lot of people, provided they're not too lax. If they're too lax and their mouth is going down and they need a sharp A lift, then you can do all that you want, and you're not going to get that effect. So you see what I did? I went right about here, and I go up above the lip, and then I inject as I'm going up and pulling out. And I can actually get a little bit of a curl effect with my skin. Okay. Now what I'm going to do is I'm going to cross this way so I'm not hiding what's going on. I'm Tom Barnes, and I'm doing a talk about expression. I'm going to move along because I got 2 more patients here. And expression comes 1.5 cc's instead of 0.8 cc's of product like Juvederm, and Restylane is what, 1.2 or something like 1.2 in the syringe. So they're comparable pricing, but you get more product with this. And the question is, how long does it last, and is it as good a product? And I think it is. I've been using it about 7 or 8 months, and I I think I've had one person who said it didn't work, and he's a guy who needs a facelift. It did work, but people forget what they looked like before, right, after the treatment. Most people find it works great. Yeah.
Who makes it? Who makes it?
Expression, that's a good question. I don't know who the master name of the company is, but Expression is the distribution. Yes. Okay. I know this as Expression. I know the guy who started the company. He's the same guy who brought Radius over 10 years ago. Okay, so, all right, so I'm gonna go up the cheeks, what she would like, and I did a mini lift on her about 8 months ago, a year ago.
January.
A year ago. So it's not unusual that things settle a little bit, and so now we're just gonna put a little bit up here, and I'll pick an area where it's flatter, and I go relatively deep in these areas, and then I pull out, and then as I'm pulling out, I put it in and I fan it under. Okay, when I inject around these areas,
How deep are you, Tom?
I tend to make fewer holes in the skin. I was about a centimeter down.
Not on the periosteum. but
You
above.
can. Peter's gonna talk more about that. He dives deep right down to the periosteum and mixes radius with hyaluronic
But
acid.
with this material, you'd rather be halfway between.
Yeah. You know, you're gonna find what works in different patients. Sort of, I don't think that, in my opinion, you kind of find what works.
Tom, do you stack the depths of it or just put it all?
Yes, I do that too. In her, I'm just, like he said, I'm going about a quarter inch, I'm going in and I'm pulling out. Okay, so now what's this?
How much massaging you do in general, Tom?
Not much. I just push like this. Just like I hold it like this. If you have any words of wisdom anybody does, you can blurt right out. Okay, I'm gonna come over here because I went over here and I did this thing over here. I'm gonna go in here because this is an area she pointed out to me. I'm just about done, and then between patients, I'll answer questions. I do a lot of putting product in as I pull back. I have a little bit left. I see this cheek is up a little bit higher anyway than this one over here. And this gives me an opportunity. I have like 0.2 left. I'll come from this side. And that's how. Okay. So I'm going to put this guy there. Can I get some, Lindsay, some ice?
Yeah.
Back there, I think you have ice.
Those back there are pretty good.
So not a big reaction. She could go back to work. What about bruising? It's about like any other HA I use. I can't say that there's a huge difference in that. Okay. I'm gonna have you pop up and then we have you like this.
Thank you.
I don't really
No.
necessarily
How
massage.
about in the lips when you do in other areas, like lips, no?
I don't massage, but I'll take a lip and I'll squeeze it a little bit and I'll go along the whole thing to try to get evenness, to answer your question.
Yeah, that's kind of where I was
Yeah,
at with that.
I'll pinch, but I don't do this. I'm a little superstitious about kicking up a little dust in there. I'm not saying I have all the secrets, I'm just saying how I do it. And, okay, maybe you can walk by here and show them how fabulous you are. And my face tuck people, I find we do a lot of this for maintenance.
How much product you put in the cheek there?
Pardon me?
How much product did you put in the cheek there?
It was about 1 cc, half and half. But I have people, that's a good question. This happens all the time. When I first heard this from Steve Mulholland about 9 years ago or 10, no, 8 years ago at a lecture when Restylane was new. You have people come in, and Dr. Fragan probably never has this in his wealthy population, and they'll need a facelift, a body tuck, and everything else, and they'll come in and say, I don't have much money, and the face will be like this, and they'll say, I just want one syringe, and I want this.
Yeah.
And I have to have the talk with them, as Steve said, and this was really valuable. Why? I thought, don't even touch people like that, because they're the same one who's going to come in and go, it didn't work. It didn't change anything. So I have to talk with them that, can you paint your house with 1 can of paint? Okay? You can try it, but it's not going to do much. Okay? You need 4 cans of paint. And if 4 cans of paint, if it doesn't make sense to you financially, and sometimes I'll give them a break to try to get them at least 2 cans of paint, then I'll say, it's probably better if you don't do it, because I don't think you're gonna be happy. So I do have that talk. How many other guys have had that talk? Yeah, okay. Because what we don't like is to do a procedure and have somebody come back and be unhappy, right? That's no fun. Because that's the very room that you don't want to go in, right? When you're busy all day, and that's the one we know you have to go in, right? Most. Okay, numerous dos. Okay, this is Jordy, and Jordy is a makeup artist, professional.
Show me more makeup.
And, yeah, she's more makeup. And she's a professional, and does a lot of photography, and works with a group that does professional pinups. Sexy but not, what is it, sexy but not? Retro, 50s, 60s. And we have a lot of girls, wives that come in, that they make calendars, and they give them to their husbands. Sexy but not revealing. Ron, you may want to.
I think that's great. Do the husbands make copies and sell them?
Good. Okay, so, okay, this patient number 2, we're doing the expression. It comes as 1.5 rather than 0.8 like Juvederm or 1.2 like Restylane. It flows pretty well. You saw that she didn't have any pain, and so I find a lot of people now, I just won't put numbing on them, and I think that's valuable for the acne people, because I find just putting cream on can moisturize areas, and it's kind of gets a filling effect, and it makes it a little bit harder to see. And the acne people, I also would use tangential light on them, so it really brings out the shadows, because it's the shadows that reveal that they've got these depressions. You know who taught me that? When I was in training, Jim Fulton.
Oh, really?
Bless him. Everybody remember Jim Fulton?
Yeah.
Wow, things have changed. He was quite a mover shaker. I did a fellowship with him in '95 and stayed on with him for about 2.5 years total, almost 3 years. And he died this year of colon cancer. And he was quite a mover shaker back in the day. He was a dermatologist and one of the first guys in this town who was doing tumescent lipo back in the early '90s, and facelifts and so forth. So, okay. All right, where are we talking about? Okay. Okay. We talked about a little teardrop for her. I might go ahead and do that today. Do you all know about teardrops? And let's start with her nasolabial folds, because that's what bugs in the most. Okay? We might get around to the teardrops. You okay?
Yeah,
Okay.
just tired.
Okay. All right. So 1.5. Sometimes what we'll do is I'll transfer this to a 1 cc syringe, and before I start some of it, and we'll tag that with the name, and then we have a special place we put it for patients so they can come back later for a touch-up, and I don't charge them anything additional. Probably not the best policy in the world. Do other people do that too?
I give
But I
it a
won't
patient.
charge.
Try it.
That's good too, so you don't have any issues with that, yeah. And so now we have a drawer with, you know, all these things in it, and, you know, what do you do with it? So I think that's probably an issue that really hasn't been addressed.
I tell them I'll keep it like a couple months and then we pitch it.
Yeah.
So if they don't come back in a couple months, it's gone.
Yeah. That's
Because
another
I don't
one.
think you want to be hanging on. for
Yeah.
long.
I try to use it all up. I mean, you know, if I keep looking for other spots and, if I got half a syringe and most patients are okay with you looking somewhere else if they want to fold, but all of a sudden then you find some other area you can finish a syringe up.
You could finish a shrink, really easy, syringe and a half.
Yeah, you know, I also, I break up my syringes. I don't, I kind of estimate the amount they need and I sell them proportionally, I charge them proportionally so that in the end, I never really waste any stuff. But if I bring them back, and they've saved some extra, I charge an ejection fee,
How much?
$150. Just covers, the little cost of the next thing. That's right.
I don't know if I could do that in my practice. I don't know. It just depends on what your population, what works.
Yeah, true.
Doing very similar to what we saw before. Is that hurting at all? So you guys are seeing this up close. It does a nice fill. It seems like a little bit of a, when you push it, it's a little less viscous. So to answer your question, which is a good one, I don't see as much of the, wow, there's a bump. Sometimes you'll inject and the product will squirt laterally, there'll be a little bump there. I see less of that. It still can happen, but I think it's less. Yeah.
10 gauge needle. Someone
Yeah, I
wipes
use
it.
a 30, and Peter's gonna talk to you about his needle, which I think is really cool, and I'm gonna start using it, which is a 27 gauge, 1 inch, and it's a blend at the end, and it's got a little port on the side, with the concept being that it might be a little harder to get into an arterial.
Yeah, sure.
So she didn't take a whole lot to make a difference. Are you good?
Do you have any specific techniques to raise the size of the lips?
When I'm doing lips, and let's see, is she coming?
Stephanie?
Yeah,
Oh, she's supposed to be coming.
okay, because we're gonna do some lips on her, or I can get Susan back, or I can do Lindsay's. I come in, there's several ways. I find out, some people, I haven't seen this as much anymore. It's about Ron Cragen's patients he's sending. They come in with 10 pictures out of magazines of lips that are like 18-year-old supermodels. And I have to tell them, your lip is like a little flat little thing, you've lost everything, and you can't see a front anything anymore, you're just a flat thing. I can't get them like that, but I can fill them some. And it just depends on what we're after. If somebody wants to go curl up a little higher, I'll go along the upper border of the white lip where it's the red lip there. And I'll fill there more at Cupid's bow and maybe pull it up a little bit. If there's somebody, I call it the Michelle Pfeiffer, they have a flat lip, then I might just go right into the lip here. Okay, for that, I use the numbing cream because that's got a lot more nerve endings there. And I will inject along here. Some of them want it right under here. Some of them want it right here. Some of them, they want a little pouty thing right here. So I'll go in and try to pop that out a little bit. So those are kinds of things I do. Does anybody have anything to add?
The commissure is the.
Yeah, we did that on the last gown.
Okay.
Where do you place that to raise the counter?
I'll go in like right here, and I'll go pretty superficial right there.
You inject it right at the counter, sure?
Yeah, I do. But then I'll also, and that filled that right up. But I'll also, as I said earlier, I'll inject it up this way to try to get a little bit of a curl in the lip. Now I know on her that's gonna work, but if somebody I was saying before is down like this, I mean, you can try it. But
Does this product have local anesthetic in it?
this does not.
Does not.
And she's having
But
no
it,
pain.
but it doesn't stain. Okay. Good.
No,
One area-
not so far, not with these.
The one area a lot of people want to fuller is the outer part of the upper lip.
That's-
Yeah.
That's the other one.
how do you get that,
Well,
the outer part of the cover?
the outer part, right over here lateral.
That's right, that's
Okay,
exactly.
I'll do a little bit, because you could use a little bit, is that okay? Okay. Come from this direction, it's got a little lipstick on it. And I go right up here and I go relatively superficially, and I inject just like that. And it tends to pop it out like this a little bit. Now, once,
That is the weirdest feeling in
now,
the world.
if you want to look at that, you can tell them if you see a difference now of this one and this one. It's nice, it's a nice kind of subtle little, improvement. Yeah, roll up.
Yeah, it feels like a breeze.
Now, once you go into the lip, there's a lot more nerve endings. And you notice I'm holding the area, it's not holding, but to answer your question, I'm not massaging, but I'm holding. Because the lips are red, you got a lot of vessels, got tons of vessels. And then you got a muscle in there. And you don't have much between the muscle and the lip, you don't have a lot of fat in there, so you got every reason in the world for this thing to ooze, right? So you just hold it. Okay? See how it popped it up a little, like I injected, she has lipstick, I went in the skin, down right here, and just popped it right there. And what it did is this, what it did is went from this to this, for those that want that, okay? I did on her because she's got some makeup on, I mean, she's got some lipstick on, but you can go from the lip side, actually, I prefer to go from the white lip down into the red lip, I prefer that. The last thing in the world you want, and it always happens, somebody who has to go right back and she's a stockbroker and has a meeting in half an hour. And you're gonna do one more little stick, one more, that you don't really have to do. That's the one where blood chases you out, right? That's the one. So around the lips and everything out in this area, I always hold a little bit, and I'll have her hold it too, just like this. A little more compression, yeah. I'm gonna do a tiny bit over here, and she knows she might get a little bit of that piece next to her. I'm pretty superficial in the lip there. Okay? See that? It just kind of pops it out a little bit. There you go. Just hold that. Any other questions? Okay? I'm gonna do a little bit more now. Now, no, she'll hold that. And her cheeks are real nice and full. She's got a lot of nice soft tissue in her cheeks.
So how are you selling your patients on expressions? Because it's a new product, they come in, they know Juvederm, they know Restylane. Are you changing a different fee for your expression in your office? Charging a different fee?
There's a lot of ways you can do it. One way you can do it is you can charge by syringe, because they're used to a syringe of Juvederm. If you wanted, you just give one syringe of this, and then you're really charging for your time and for one syringe, you can do that. Or you want to give them all 1.5, it's your call, whichever works for you.
What do you charge?
I charge $6.50 for a syringe, but usually what I do is end up saying, you know, I've got more product for you and we need a little more, and I'm just gonna give this to you. I think, as Ron knows, because we do facelifts and lipos and other things, that's really my end game, isn't it? So if you're doing nice things for nice people, then they may come to you for those things.
So you have a fee for a syringe, not a fee for Juvederm, and a fee for expressions, and a fee for...
I just do this now. I'm not, Peter will get into this and you maybe can comment later on the fine differences of this one versus this one. I know, well, let's talk about that. Yes, I had some people when I was doing this area, tear trough, with Juvederm that swelled a little bit more. And there are those that believe that Restylane is better in this area, you get less swelling. With this product in that area, I still occasionally see some people swell more, but most don't swell that much. Can I do one more thing? No, I don't want to hold him up. Okay, honey. With that, and this is extra, and we're going to take a few minutes.
Thank you. Applause.
We're over. I'm going to stop because we're over. Thank you.